Your doctor talks about cholesterol, blood pressure, and medications. But there's one thing they rarely mention: vitamins. These nutrients keep your heart strong, support circulation, reduce inflammation, and help prevent serious complications. The real issue? Most people are missing key vitamins for heart health and don't even realize it. If you're dealing with fatigue, high blood pressure, or circulation problems, this could change everything. Today, I'll reveal the top 4 vitamins your heart needs, and by the end, you'll know exactly which foods and supplements can strengthen your heart and protect against disease. Let's start with number 1. 1. Vitamin E. Vitamin E is one of those underrated nutrients when it comes to heart health. Most people think of it as just an antioxidant for skin or immunity, but it plays a huge role in keeping arteries flexible, preventing plaque buildup, improving circulation, and lowering the risk of heart attacks and strokes. The problem? A lot of people, especially those with heart disease or high blood pressure, are deficient in vitamin E without even realizing it. Research shows that individuals with heart disease have 20 to 40% lower plasma vitamin E levels, which significantly increases oxidative stress and arterial damage. The way it works is simple but crucial. Vitamin E prevents cholesterol from turning into arterial plaque, reduces inflammation inside blood vessels, and helps maintain proper endothelial function, which is basically what keeps your blood pressure and circulation stable. Without enough vitamin E, arteries become stiff, blood pressure rises, and blood clots are more likely to form. Studies show that people with low vitamin E levels have up to a 30% higher risk of developing heart disease and stroke, simply because oxidative stress weakens blood vessels over time. As we get older, the body becomes less efficient at absorbing and using vitamin E, making deficiency more common. Conditions like high cholesterol, metabolic syndrome, obesity, and liver dysfunction make things even worse since they interfere with fat absorption, which is how vitamin E is transported in the body. A deficiency often goes unnoticed at first, but symptoms like fatigue, muscle weakness, slow recovery from exercise, poor circulation, and numbness in the hands and feet can all be warning signs that your heart and blood vessels aren't functioning as well as they should. Studies suggest that individuals with low vitamin E levels are 35 to 50% more likely to experience heart failure, atrial fibrillation, and arterial blockages compared to those with adequate levels. When vitamin E levels drop too low, the entire cardiovascular system starts to struggle. The heart muscle weakens, meaning it has to work harder to pump blood. Blood vessels lose their flexibility, increasing resistance and making high blood pressure harder to control. Poor circulation leads to cold hands and feet, while reduced oxygen supply to tissues causes dizziness, shortness of breath, and muscle fatigue. Even brain function takes a hit. Low vitamin E has been linked to a 30 to 40% higher risk of stroke, cognitive decline, and memory loss, because poor blood flow means less oxygen reaching the brain. Now, getting enough vitamin E from food is totally possible, but most people don't eat enough of the right sources. Some of the best foods include sunflower seeds, 28 grams equals 66% of daily needs; almonds, 28 grams equals 48%; hazelnuts, 28 grams equals 28%; avocado, 100 grams equals 14%; and wild-caught salmon, 100 grams equals 10%. Regularly eating these foods has been shown to reduce arterial stiffness by 20 to 25%, lower oxidative stress markers by 30%, and decrease the risk of blood clots. If you want a gourmet approach, black truffle-infused almond butter with roasted hazelnuts, 50-gram serving, is an excellent choice. It delivers over 50% of the daily recommended intake, and truffles contain polyphenols that enhance blood vessel function and improve circulation. Another great option is wild-caught salmon with avocado lime sauce, 200 grams salmon plus half an avocado, which provides over 30% of daily vitamin E needs while also increasing omega-3 absorption, which further protects the heart by reducing inflammation and improving blood flow. And for something luxurious, saffron and sunflower seed-encrusted lamb chops, 180-gram portion, deliver over 40% of daily vitamin E intake, with saffron adding extra anti-inflammatory benefits for blood vessels and circulation. Now here's where it gets interesting. Vitamin E needs fat to be absorbed properly. That means if you're eating vitamin E-rich foods without enough healthy fats, you might not be absorbing as much as you think. To maximize bioavailability, vitamin E should always be eaten with sources of healthy fats, such as olive oil, avocados, or fatty fish. Cooking methods also matter. Light roasting and raw consumption help preserve vitamin E, while deep frying or prolonged high-heat cooking can destroy up to 30% of its content. Research even shows that pairing vitamin E with vitamin C enhances its antioxidant power and further protects blood vessels from oxidative stress. If you're struggling to get enough from food alone, supplements can help, but quality matters. D-alpha-tocopherol is the most bioavailable form of vitamin E, and studies show that taking vitamin E with cofactors like vitamin C and CoQ10 improves its effectiveness. The two best options are Solgar vitamin E, 400 IU, and Now Foods vitamin E, 400 IU, with doses ranging from 200 to 800 IU per day, depending on deficiency levels. Research shows that supplementing with vitamin E can lower LDL oxidation by 40%, improve vascular function by 20 to 30%, and reduce high blood pressure by 5 to 10 millimeters of mercury in people with cardiovascular disease. But here's what most people don't realize. Certain foods and habits can actually make vitamin E deficiency worse. Refined vegetable oils, soybean, canola, sunflower, throw off the omega-6 to omega-3 balance, increasing inflammation and making it harder for the body to use vitamin E effectively. High-sugar diets and processed foods rapidly deplete antioxidants, forcing the body to burn through more vitamin E just to keep up. Excess alcohol weakens liver function, where vitamin E is stored and metabolized, making deficiency more likely. Even whole grains like wheat and brown rice contain phytates, which bind to vitamin E and prevent proper absorption, so people relying on whole grains as a major part of their diet might unknowingly be reducing their vitamin E levels. Fixing a vitamin E deficiency isn't just about taking a supplement. It's about eating the right foods, reducing inflammation, and making sure your body can actually absorb what you're consuming. A strong, healthy heart depends on making sure this essential antioxidant isn't missing from your daily routine. Research-backed strategies, from whole food sources to high-quality supplements, can help reduce cardiovascular risk and keep arteries flexible, blood pressure stable, and circulation strong. Let me know if this was helpful in the comments. Please subscribe to us to help us grow. Now let's move on to number 2. 2. Vitamin D. Vitamin D is far more important for heart health than most people realize. It's not just about bones or immunity. It plays a major role in reducing inflammation, keeping arteries flexible, and protecting against high blood pressure, heart disease, and strokes. The problem? Most people, especially those at risk for heart issues, are deficient in vitamin D and don't even know it. Research shows that individuals with low vitamin D levels have a significantly higher risk of high blood pressure, arterial stiffness, and heart attacks. Yet many people never check their levels. Low vitamin D is directly linked to hardened arteries, increased cholesterol, and a higher likelihood of heart disease. One of its key roles is regulating calcium balance, preventing excess calcium from building up in artery walls. Without enough vitamin D, calcium deposits in blood vessels instead of bones, leading to dangerous plaque formation. Over time, this makes arteries stiffer, circulation weaker, and inflammation higher, all of which increase strain on the heart. Studies show that people with low vitamin D levels have up to a 60% higher risk of hypertension, atrial fibrillation, and heart failure due to worsened vascular function. Deficiency is extremely common, especially as we age. The body's ability to produce and activate vitamin D declines, and modern lifestyles, limited sun exposure, poor diet, and underlying conditions like obesity or kidney disease make it even harder to maintain optimal levels. Research suggests that over 40% of adults are deficient, and for those with heart disease, the rate is even higher. A simple blood test measuring 25-hydroxyvitamin D can confirm levels and symptoms such as fatigue, muscle weakness, slow recovery from exercise, frequent infections, and mood swings are all warning signs of low vitamin D. Many of these overlap with early signs of cardiovascular stress, making it even more important to check. When vitamin D levels drop too low, the entire cardiovascular system suffers. The heart muscle becomes weaker, reducing its ability to pump blood efficiently. Blood pressure rises as vitamin D is essential for relaxing blood vessels and improving circulation. Arteries stiffen, increasing the risk of heart disease, while poor circulation leads to cold hands and feet, dizziness, and shortness of breath. Even brain function is affected. Low vitamin D is linked to a 40% increased risk of stroke, cognitive decline, and memory loss, likely due to reduced blood flow to the brain. Getting enough vitamin D through diet is possible, but not always easy. The best sources include cod liver oil, 1 tablespoon equals 340% of daily needs. Wild-caught salmon, 100 grams equals 130%. Sardines, 100 grams equals 110%. And egg yolks, 2 large eggs equals 100%. 20% mushrooms exposed to sunlight can provide about 40%, but only if they've been grown under UV light. Research shows that individuals with higher vitamin D intake have lower markers of inflammation, improved artery flexibility, and reduced blood clot risk, making it essential for long-term heart health. For a gourmet approach, Japanese miso-glazed salmon, 180-gram portion, provides nearly 150% of daily vitamin D needs, along with heart-healthy omega-3s. Norwegian pan-seared cod liver, 80-gram serving, is one of the richest sources, delivering 300% of daily vitamin D requirements, while also providing essential fats that support vascular health. Black truffle scrambled eggs with shiitake mushrooms, 2 eggs plus 50 grams mushrooms, provides 60% of daily vitamin D needs, making it a luxurious and heart-friendly breakfast option. If food alone isn't enough, supplements can help, but not all vitamin D supplements are the same. Nordic Naturals, vitamin D3, 1,000 to 5,000 IU per softgel, is highly bioavailable, while Thorne Research vitamin DK2, 5,000 IU per capsule, combines vitamin K2 to ensure calcium is directed to bones instead of arteries, preventing arterial calcification. Research shows that supplementing with vitamin D can reduce blood pressure, improve endothelial function, and decrease the risk of arterial stiffness over time. Certain foods and habits can worsen vitamin D deficiency by interfering with absorption and metabolism. Processed vegetable oils like soybean and sunflower oil increase inflammation, making it harder for the body to use vitamin D effectively. Refined carbs and sugary foods deplete magnesium, which is essential for activating vitamin D. Excess alcohol weakens liver function, where vitamin D is converted into its active form, reducing effectiveness. Even whole grains like wheat and brown rice contain phytates, which bind to minerals and reduce vitamin D absorption, making it harder to maintain optimal levels. Fixing a vitamin D deficiency isn't just about taking a supplement. It's about getting enough sun, eating the right foods, and ensuring proper absorption. Research-backed strategies from dietary sources to high-quality supplementation can lower cardiovascular risk, improve circulation, and keep arteries flexible and healthy. If you're not already prioritizing vitamin D for heart health, now is the time to start 3. Vitamin B12. So first off, most people don't connect B12 with heart disease, but the link is massive. The number one reason? Homocysteine. This amino acid is toxic to your arteries when it builds up in your blood. Think of homocysteine like corrosive acid. It damages artery walls, makes them stiff, and increases plaque buildup. Over time, this raises the risk of heart attacks, strokes, and high blood pressure. B12's job? To clean it up. It converts homocysteine into methionine, a safe amino acid that your body can use. Without enough B12, homocysteine levels skyrocket. Studies show that B12 deficiency can increase homocysteine levels by up to 50%, which in turn raises the risk of heart disease by 50 to 80%. And here's where it gets worse. People with heart disease have on average 20 to 30% lower B12 levels than those without it. That means if you already have high blood pressure, cholesterol, or a history of heart issues, B12 deficiency is making things worse. Now let's talk about oxygen and circulation. Your heart is a muscle, and like any muscle, it needs oxygen-rich blood to function properly. B12 is directly involved in red blood cell production, meaning it ensures oxygen is delivered efficiently to the heart and throughout the body. When B12 is low, red blood cells become too large and misshapen, leading to poor oxygen transport. The result? Chronic fatigue, dizziness, shortness of breath, and an overworked heart. Studies show that B12 deficiency doubles the risk of anemia-related heart palpitations and irregular heartbeat, arrhythmia. And here's where it gets even more interesting. B12 is crucial for blood vessel health. Inside your arteries, there's a thin, protective lining called the endothelium. It helps regulate blood pressure, prevent blood clots, and keep arteries flexible. But when B12 is low, this protective lining becomes inflamed and stiff. Research has found that people with low B12 have a 30% higher risk of arterial stiffness, which directly contributes to high blood pressure. In one study, B12 supplementation lowered systolic blood pressure by an average of 10 millimeters of mercury, showing just how powerful it can be. Now let's talk about cholesterol. While B12 doesn't directly lower cholesterol levels, it does help keep LDL, bad cholesterol, from oxidizing and forming plaques in the arteries. One study found that people with B12 deficiency had significantly higher levels of LDL cholesterol and C-reactive protein CRP, a marker of inflammation that predicts heart disease risk. And then there's nerve health. This is one of the most overlooked aspects of heart function. Your heart rate and blood pressure are controlled by the autonomic nervous system, which relies on healthy nerve signals to function properly. When B12 is low, nerve function deteriorates, leading to poor heart rate regulation, episodes of low blood pressure, or even sudden heart palpitations. A study found that people with low B12 had a 70% increased risk of autonomic nervous system dysfunction, which can cause blood pressure swings and heart rate irregularities. Aging makes all of this even worse. By 50, your stomach produces less acid, which is essential for absorbing B12 from food. That's why B12 deficiency is rampant in older adults, and it's directly tied to higher rates of high blood pressure, heart attacks, and strokes. If you're over 50, B12 supplementation is not optional, it's necessary. And let's not forget medications that block B12 absorption. If you take acid-reducing drugs, PPIs like omeprazole, lansoprazole, or diabetes medications like metformin, you're at an even higher risk for deficiency. All right, so we know B12 is critical, but how do you fix it? Food first, supplements second. The best sources of B12 are animal-based foods because plants do not contain B12. Beef liver, 100 grams, delivers 3,500% of your daily needs. It's literally the most potent natural source of B12. Clams, 100 grams, even better, 4,000%. Sardines, 100 grams, give you 350%, and wild-caught salmon, 100 grams, packs 200%. Even 2 large eggs provide 25%. Now, if you like high-end foods, here's where it gets interesting. French foie gras with truffle sauce, 150-gram portion, gives you 2,500% of your daily needs. Japanese uni, sea urchin, sashimi, 100-gram serving, contains 3,000%. Lobster thermidor, 200-gram portion, delivers 1,500%. So if you enjoy fine dining, you can literally replenish B12 in style. But let's be honest, not everyone eats liver or sea urchin. That's where supplements come in. Jarrow Formula's methyl B12, 5,000 micrograms per lozenge, is a top-tier option because it dissolves under your tongue, bypassing stomach absorption issues. Thorne Research methylcobalamin, 1,000 micrograms per capsule, is another excellent choice, highly bioavailable and proven to support nerve repair, heart function, and energy levels. Here's where you need to be careful. Certain foods and lifestyle choices worsen B12 deficiency. Excess alcohol damages the stomach lining, making it harder to absorb B12 properly. Processed grains like white bread and pasta have zero nutrients and actually increase inflammation, making B12 absorption worse. Acid-reducing medications, PPIs like omeprazole, lansoprazole, lower stomach acid, and you need stomach acid to extract B12 from food. Refined sugar and junk food accelerate nutrient depletion, making it harder for your body to hold on to B12. So here's the takeaway. If you're experiencing heart palpitations, high blood pressure, circulation issues, or chronic fatigue, check your B12 levels. Don't wait until you're dealing with serious heart problems. Start adding B12-rich foods to your diet, and if needed, get a high-quality supplement. Your heart, arteries, and energy levels will thank you for it.